internationally recognized celebrity. You may be familiar with Rose McGowan from her role on the cable television series Charmed. But Rose is also a daughter who suffered the shocking loss of her father. Daniel McGowan had been diagnosed with idiopathic pulmonary fibrosis. Mr. McGowan died in 2008 at the age of 62, and since her father's passing, there's been a lot said about this disease that has no treatment. Rose has made it her mission to raise awareness of the disease, and she's here with us this afternoon to share her story, along with Dr. Eric White, who is a pulmonary specialist. Guys, thank you so much for joining me this morning.
Thank you.
Rose, this is an incredibly difficult story. Could you share with me what it was like to lose your dad?
Well, you know, seeing my father go from being a very strong and healthy man to being somebody who could barely walk up a small flight of stairs was understandably extremely hard. And one of the reasons I'm here is to just get the word out about IPF, idiopathic pulmonary fibrosis, because the earlier people are diagnosed, the more treatment options they have to manage the symptoms. My father wasn't lucky enough to have had a good quality of life while suffering from the disease because he was misdiagnosed for a while. And that's a normal thing because it's a lung problem. It masks itself. It could be seen as asthma, emphysema, or pneumonia. And the thing was with my dad, he didn't get the right diagnosis, so that he wasn't put on the right regimen for a long time, you know. So
Rose, 6 children, how did this loss impact your family?
Well, we were all devastated. He was our best friend. You know, I have a lot of brothers and sisters, obviously, and he loved all of us very much, and we wish he could still be here.
And how was it? You played a huge role for his treatment. How was that?
He did, you know, and one of the things that's great about being here and talking to you, Jimmy, is that it's just helping get the word out about IPF.
And Rose, thank you. I know it's very difficult to tell this story repeatedly, but thank you so much. Dr. White, let me ask you, how common is this disease?
Well, it's not common disease. It's a rare disease. And so it's important that we educate the public about idiopathic pulmonary fibrosis. It looks, like Rose said, it can look like emphysema, it can look like asthma or pneumonia. It causes shortness of breath, it causes a cough that won't go away, it causes chest tightness, and those are all symptoms of other lung diseases as well. But this one is different. It's a progressive disease, it's a scarring disease of the lung, and it's a fatal disease. There are no treatments available for it right now, as you said, but we do have management options for patients. We have the ability to provide them oxygen, to provide them medications to control the cough, to control the shortness of breath. In certain cases, we can do lung transplantation, but that's the exception, not the rule.
Rose, Dr. White, thank you so much for your time this afternoon explaining such a thing. Now, Rose, you are a big famous actress, and I can't let you go anywhere without telling me what you got coming down the pike for you.
Well, I have a movie called The Telltale Heart that's coming out, and I just finished my first directorial effort. And something that is the most important thing to me, honestly, is my work with the coalition. So if people could go visit the coalitionforpf.org, that would be amazing and make me so happy.
Rose McGowan, thank you so much. Dr. White, thank you very much. Now, just in case you would like to know more about Rose's story, you know, by the way, did you know there's also going to be almost 50,000 new cases of IPF diagnosed this year alone? How about that? Let's toss it over to Lisa, who's got more now on this disease.
Well, Jimmy, Rose seems really passionate about getting the word out about this disease, and for good reason. The Coalition for Pulmonary Fibrosis reports 40,000 people die each year from IPF, the same as to breast cancer. Now, the coalition reports 2/3 of IPF patients pass away within 5 years of diagnosis. Now, there is no known cause, no FDA-approved treatments, and sadly, no cure for IPF. So knowledge on this disease is key. Here to break it down for us is Dr. Yashvir Sangwan, pulmonary specialist with Peninsula Regional Medical Center. Thanks for joining us this afternoon.
Thank you.
So you heard Dr. White.
Yes.
So what do you think?
Well, a lot of points were brought up about this disease. All right. Now, if you take shortness of breath and cough, many people who come to primary care doctors have those symptoms, and not everybody will have IPF.
Right.
Now, if you are less than 45 years old, your chance that your shortness of breath is because of IPF is 1 in 30,000. But if you are greater than 75 years old, the chance is 1 in 500. So it's not that rare of a disease. It's a
Right.
disease of the elderly.
So it's a very complicated disease, very complex, right?
It's very complex because when you look at lung scarring in general, you are talking about 150 plus diseases. Okay. Now IPF is just one of those diseases. So if you look at 500,000 people in the United States who have lung scarring, around 130,000 actually will have IPF. Okay, and I do suspect that most of them are diagnosed on the basis of X-ray and not on the basis of a pulmonary consultation, where we make sure that they don't have any other reasons of having disease that look like IPF.
So because of that, a lot of times it's diagnosed too late, right?
Yes, it's often diagnosed too late, and the reasons for that are very easy to understand. Okay, now if you are 75 years old and you have some shortness of breath and cough, living in America, most likely you are overweight. Most likely you do not move much. Okay, and so you say, I'm short of breath, so what? I'm 75. That's what it's supposed to be. 6 months later is the average time that you actually go to a doctor. Okay, and you say that I'm having cough and shortness of breath. These are such non-specific complaints that the doctors usually will treat you for community-acquired pneumonia, asthma, emphysema, okay, before they start thinking about IPF. And even then, most of the IPF X-rays can look like heart failure. And when you listen to the lungs, they crackle. Okay, the reason they crackle is because these lungs are hard; they are not soft; they are scarred up. Okay, so with every breath, they are like sandpaper. Exactly the same finding that you'll find in heart failure. So most of these patients actually end up going to a cardiac doctor before they come to us. By the time they come to us, the X-ray looks completely different.
And we have that.
And you have that X-ray.
We saw one, and then
All right.
take a look at that. That looks totally
Now,
different.
by the time, it's already 2 years since the symptoms first started, on an average, when they look at it. When you come with those symptoms, with that X-ray, I can't do anything for it, because even if you have other causes that makes the X-ray scar up like that, which are treatable, okay, being on medications, having connective tissue disease, working in chicken farms, for example.
So many.
So many of the other diseases that I could have stopped, okay, in their track by finding out what the reason is and treating that reason. You have not given me the opportunity to do that.
Right, so you have to really know what to look for in the X-ray. You have to be looking for it, really. Let's talk about risk factors. Are there any?
No, because the very fact that you call the disease idiopathic pulmonary fibrosis is because idiopathic means you don't really have a cause, okay? But that diagnosis should not be made on the basis of an X-ray. So many people will have scarring on their X-ray and the doctor tells them this looks like IPF, it has exactly the same distribution, okay, in your lungs, and we can't do anything for you. And you know, you should fix your things up and prepare for death in maybe 2 to 5 years. But that might not be true, because IPF is not just X-ray, it is also a clinical diagnosis, and you need to come to a specialist. You need to spend at least 1 hour or 2. Most of my patients with IPF, they get that time. Why? Because it's very intricate detective work.
Right.
And I have to go back 10, 20 years, look at all their X-rays, see the progression to find out whether this is actually IPF or just a mimic. Okay.
All right, thank you so much. Such
No
good
problem.
information. Of
Thank
course,
you.
knowledge is key. And if you would like to learn more about it from PRMC, go to delmarvalife.com and click on the show tab. Well, a healthy body can start with a healthy mouth, so it's important to get our kids on the right track early. But exactly how early? From when they should start going to the dentist to when they should start brushing their teeth, we'll find out. Plus, we've all had to deal with it at one point or another, I'm sure of it. We're talking body odor. We'll find out why it may be all about what you eat. Delmarva Life will be right back.